All right.
Thank you. Oh, go ahead.
No, go ahead. I'm gonna let Donna introduce herself and tell us all about what she's gonna teach us.
All right. So thank you so much for having me today. As I told someone earlier, this has definitely been the week of pivot if you are a Texan in any kind of capacity of work. And so I know that you all have had to pivot this week like we have. And so we had multiple events canceled, shifted, that kind of thing. In fact, we had one event that was postponed 3 times. Because one day led into another day, led into another day. So, and even, as I'm coming up, y'all are scraping off the sidewalk and that kind of thing. So thank you so much for being here today and inviting me. And my name is Donna Breedlove, and I am a regional manager for the Texas Health Steps Outreach and Informing. And I'll explain that in a moment. And how I got here is Judy was actually the contact in your area, and she was my counterpart, and she covered this region, which is Region 7. I'm actually the manager for Region 3, and so I work out of the Arlington office, but behold, I live in Dawson, if you know where that is. And so whenever someone said something about coming over here, I'm like, hey, I'm just not very far at all, especially if you live out where we do. You're used to driving anyway. And so, and we come to Hillsboro quite often. And so I said, hey, I can jump over and do that. So super excited to be here with you all. So we are, as I said, Texas Health Steps, and the Texas Health Steps program outreach and informing. So what we do for the state of Texas is we, just as our name says, we're out in the community, but we do outreach. So we do home visits, we do outbound phone calls, and then we do all kinds of informing. So all the education on all the programs with the medical plans, okay? We don't talk about SNAP except to refer people, and so some of the other programs, but we deal mainly with the health programs, all of those. So starting with the STAR, to STAR Plus, STAR Kids, all of that, the Healthy Texas Women's Program, we talk about all of that. And so we educate people on that, and then we enroll people in their health plans. So the priority of what we do is, first of all, anyone who's pregnant and they apply for Medicaid, they send that application into HHSC, and then we get their information and we immediately outreach to them. Because pregnancy Medicaid or any escalated application immediately gets worked. And pregnancy Medicaid is like that. And so we immediately outreach to them. We start making phone calls, do those kind of things. We do quite a few phone calls to try to get in touch with them. And then we tell them with the area that you're in, these are the health plans that are available. Do you need a OB? Do you need a pediatrician to set up for your baby when the baby comes? And okay, when the baby comes, this is what you're gonna do. So we try to be one-stop shop for everything that we do. So our staff also know where the food pantries are, where the WIC offices is, where the HHSC office is in their area. So we try to direct them to any place that they need to go, and we try to meet as many needs as we can with one call. If mom has been sent to us and she has littles who are already on Medicaid, we talk about that. So it looks like, Junior needs a dental checkup. Do you know where a dentist is? Here's your dental plan. We can help set you up with that. We even do 3-way phone calls and set up doctor's appointments, and so that kind of thing. So that's what we do. And we do that in certain areas, and some of you were talking about Ellis County, and when I started in this area, I was in Ellis County, and so that was my area that I covered, and I still cover that area for quite a bit. So anyway, so that's pretty much what we do. And so we are talking all the time about the programs and about Medicaid and trying to get information out there. We do health fairs, we do presentations like I'm doing here today. We do dental programs, we do dental education. In fact, February is Children's Dental Awareness Month, and so we'll be doing those dental programs. And we try to get as much information to programs like you to schools, but also to the community, to anyone who needs us. And so we also spend quite a bit of time in the HHS offices. We go once a month in all the offices in our area, and we spend a couple of hours just being there, answering questions, helping the staff, helping clients who are coming in. And so that's what we do. We're kind of we don't know what they do whenever people see our title and what is outreach, and so but that's what we do. And so the biggest thing that we do is outreach and trying to assist everyone to just kind of navigate the system a little bit. And so for programs like you, first of all, we appreciate so much what you all do. And in all of our areas, we're involved with you in some of our areas. We've actually done for another CASA, we did a diaper drive for them one year and collected diapers for them because they were just kind of getting off their feet in one of the rural areas. And so we've done all kinds of different work with you all different areas all across our area in North Texas. And so so that's why each area across the state of Texas, because our position is everywhere, then in each area we try to be involved with programs like yours and schools and different areas so that we can help people. So, okay. And so today I've handed you out a few things. And one of them is the presentation, because, you know, with all that pivoting we've all had to do this week, and I'm glad I did it. I went ahead and printed out this presentation for you, but I'm also going to send it electronically so you'll have it then. So the one that we've chosen for you today is the Medicaid and the Texas Health Steps program, specifically as an overview of the Medicaid services for transitioning youth. And so that's going to be the main portion of our program, but I've also added in for you because this is probably one of the #1 questions we get is about this 3 for 30. And these are the checkups that all children with DFPS have to go with when they're brought into the system. And so it's just kind of an overview of what those checkups are. And so I've brought you the 2 handouts for that we provide, and that come from the Department of Family and Protective Services, DFPS. And so just kind of an overview for you of what those are. And so you all can look at those at your leisure, but I just wanted to provide those to you and just kind of draw your attention to them. That these were designated as a complete approach, as it says there at the top, for better care for children and for all the kids who come into DFPS custody. So anyway, so those are just some things that are done, and that's why they talk constantly about those checkups, because they're so important for those children, especially during that difficult time that they're experiencing. We take these to foster care liaisons at schools and try to give all that information out so that everyone is aware. So, but we're going to dig in, and our main topic is going to be the overview of Medicaid services for transitioning youth, as it says there on that first page. And these are just all the slides. And so the training objectives are going to be just to share more of the programs that I've just talked to you about, to just become a little bit more familiar with the Medicaid for former foster care children, and to familiarize yourself with those, how participants are involved in the Texas Health Steps state programs. And also just to talk about those Texas Health Steps benefits and services for young adults, and to be able to know the function and responsibilities of what we do, which is kind of what I've already talked to you about today. So the coverage is important, of course, this Medicaid and the Texas Health Steps program, because the Medicaid is anyone that applies, that gets approved, even before they're put into a health plan, they are already in what's called traditional Medicaid. And that traditional Medicaid allows them access to health care, and to be able to go to the doctor, have to go to the hospital, that kind of thing. And then they will get a health plan coverage, okay? And so before they are even in that, then they have that coverage so that they can go to the doctor. And then the Texas Health Steps program, which you'll see here in a little bit, is for anyone under 20 and younger. And it is a series of checkups that are required, and it's a certain way that a doctor will do the checkup once a child is taken for a checkup. They actually have a questionnaire that they have to go through, and they have to check or input information about that child. And that's what the Texas Health Steps program. A lot of preventative information. When they go to the dentist, they go to the doctor, it's those papers that they leave with. You know, like your child is 6 months old, these are the things you need to be looking at. These are the things you can do to engage with your child, to keep your kid healthy, those kind of things. All of that's called the Texas Health Steps program. So we're just going to talk about that. Of course, prevention is the #1 reason for all that we do, because we can prevent illness, we can prevent serious disease many times in children, and get that information to them and let them know. We still today have people who we run into who are enrolled in the programs, and they don't realize they can take their kid to the doctor for a checkup. And so we'll talk to a mom and she'll say, but my kid wasn't sick. And say, yeah, but that's okay. Those checkups are paid for. You don't have to pay anything. You take that kid to the checkup. Let me help you with it. So Star Health is the first avenue of the medical help. So like I said, when someone's first approved, they're put into what's called traditional Medicaid. And that's usually only lasts for just a few weeks. And then after that time, then they're given the opportunity to apply into Star Health, and then they can choose whatever health plan they want. Now, some populations don't choose. Foster care children are one of those. They have their own specialized health plan, and that's the health plan that they're in. But pregnant women, children, any of those other populations, then they have 2 or 3 health plans that they can that they can choose to be in. And so that's how that is. So Star Health is nationwide. It is the comprehensive managed care program for children and adults who are part of the healthcare system. And then that also applies for anyone with the DFPS conservatorship. So Star Health also includes coordinated and medical and behavioral service management. I'm so used to a thing, I'm trying to do this, sorry about that. So Star Health is part of the, what's included with it is service coordination and medical and behavioral service management. That is part of their Star Health benefits, okay? And so Star Health also has added value services that comes from the health plan, and they are expanded vision, over-the-counter drugstore services. They have many care grants. They also have the A2A Cent account rewards programs based upon their health services. They have a behavioral health 7-day follow-up program. And then they also have online mental health resources. They can access an online therapy, some of those things. And some of the programs that you use are actually aligned with Star Health. That's how their billing happens, is through the Star Health. And so they also have, and a lot of people forget about this one, Boys and Girls Club membership is automatically available to them. And then they also take care of those sports and camp physicals that some of those kids need at certain times of the year. So those are some things that Star Health does cover. And then the youth in transition from former foster care children, they qualify for enrollment in 2 different programs of Medicaid in the managed care. So first, if they are 18 to 20, they will continue to receive their benefits through Star Health, that Star Health program, unless they want to change to regular Star or Star Kids. And the difference between those is usually some of the coverages is just different. And with Star or Star Kids, they have an opportunity to maybe choose another health plan. So those are some instances that might happen. If they have a specific doctor that they only want to go to, then they will take them out. They will remove themselves from Star Health and choose Star or Star Kids. But that can't happen until they're 18, okay? And so then once they're from 21 to 25, they will be removed from Star Health for sure. And then they can choose either Star or Star Plus. Does anyone know what is the difference between Star and Star Plus? Okay. So Star is the regular health plan, and then Star Plus assists the population who may have special needs. And so sometimes some of the elderly are in Star Plus. if they have special needs. And then if they're under 18, they may be in Star Kids instead of Star Health, okay? If they have extra special needs. And so, but once they turn 21, they will need to choose to be in Star or Star Plus. Usually Star Plus enrollment does require some kind of diagnosis too, okay? All right, and so at age 18, they do send them out a letter to let them know that they have the opportunity to either stay with Star Health until they turn 21, or they can change. And it gives them, in that packet, they get a packet, and it gives them all kinds of information about the health plans that are available in Star Plus, and then reminds them of what they already have, okay? It also gives them, in that packet, ability to contact contact the offices to get help or get more information, okay? And so a lot of times—
What address is that information sent to? Would it be wherever their Medicaid card would go?
For the transitioning youth, it would be the last one that they have on record. And so that's why at everything we do, we tell them, update your address, update your address, update your address.
How do they update their address?
They can do it, well, they can do a number of ways.
Okay.
They can do it through the 211. They can call that option 2, and that they'll update that address for them. And then if they already, and you would be surprised the number of youth that already have this, they already have their account on the Year Texas website, the Year Texas benefits. And so if they have an account on the Year Texas benefits, they can do it there too.
So if they create an account on there?
Yeah.
Okay.
Mm-hmm. And so they can have that, and a lot of them, they love the app. And so, and it has so many great things in there that you can do. Change plans, find a doctor. I mean, there's all kinds of different great things in there. So,
Wow.
I kept hearing your too. I did too. Your Texas.
yourtexasbenefits.com. I'm sorry.
Okay, no.
Okay.
We outreach people, we talk fast sometimes. So. So at age 21 though, or about 60 days before they turn 21, if they have not switched out of Star Health, then they will be given an enrollment kit and told that they need to, okay? And so they'll get that same enrollment kit. It'll give them all the different things about their health plan, and it will tell them all the different things that they can access with each plan and that kind of thing. Now, if for some reason they don't do the enrollment, they will, a plan will be picked for them. And so the state picks a plan, enrolls them in there, because they don't want them to have a gap in their health plan, in their health coverage. And you know, so many times with some populations, you know, getting in contact with them sometimes is hard, just like you were saying, what address is it going to?
Right,
And
yeah.
so just to make sure that they still have health coverage no matter what, then they go ahead and put them in a health plan of some sort.
So when they transition, they will be covered whether they have enrolled in that plan from when they turn 18 till they're 25.
They will be
Somebody may have chosen for them, but they will have
Yes.
something, and they could call like 211, let's say, to get their
Correct.
information.
And get the information, yes.
Sorry, I had one.
No, you're fine. And so, so that's how that transition kind of happens. And, but it has a lot of checks and balances so that we're not, because I'm glad you asked the question about the mail, that we're not only relying on that one avenue. And so, and even now they can opt in on their app to get text messages and emails. And so, which is real convenient for a lot of people. And so anyway, so they can do that. But the app is growing more and more. There's more and more things that they can do on it. So anyway, just a really good thing. So the STAR program, if they choose to get into the STAR program, which is primarily where most children, most of these transitioning youth go to, is the STAR program. And so in that STAR program, like I said, they're going to be able to pick a plan, and then they're going to have a main doctor that they pick, a PCP, in other words. And so we try to connect them with that doctor. Now, we also, in outreach and informing, with this transitioning, with some of these transition, we also have the opportunity to do a home visit for them, like wherever they are. You know, we can do a home visit and come out and talk to them. Most of the time, They don't want to do that. But we do have the opportunity where we can do that. And so, but most of the time we do that over the phone. And, but if we can't reach them by phone because our special services is trying to reach them by phone, and if their phone's changed or that kind of thing, you know, they're sending letters, they're trying to call them by phone, then we may try to access that last address at least, you know, to try to get somebody that we can talk to for them. So anyway, and so if we're able to talk to them, we do help them with the plan. We help them find a doctor wherever they're living at the moment, connect them with the plan, because after they get through with us, if they decide, you pick the you suggest this doctor and I don't really like them, and I don't want to go there anymore, so I want to pick another doctor, then we tell them, hey, you can call the health plan, and the health plan can help you too after today, you know. And then they can get set up with those extra value services. I mean, we all have the insurance of some sort, so we know, you know, there's the gift card or the whatever, and so the health plan can connect them with all of that. And so we explain that to them, help them choose, and then give them access and all those numbers so that they can find it. And then when let them know to be looking out for cards, and it's real important to keep them, you know, and to keep access with them. So until they turn 20, late into their 20, they also have dental services. And so we enroll them in those dental plans. The state of Texas only has 3 dental plans over the whole state, and that's DentaQuest, MCNA, and United Healthcare Dental. And so we connect them with that dental plan, explain all those checkups and all the different services that come with that. And so we also give them all the contact information for those that plan too. They always can, if they also have questions past the time that we talk to them, or even in the packet, they will see this telephone number, 1-800-964-2777, everywhere. It's on every document that they get, and they can call that number to ask questions about what can I do? How do I do this? What plan can I choose? And then also they give them the website here, which is Texas Medicaid Events, which is a list of all the events that we go to. So we may be at a health fair and someone brings, I've had it happen a number of times, someone brings me a packet and they're like, I got this in the mail and I don't know what to do with it, you know. And so we usually what I do is I set up another time where I can talk to them, you know. And it's like, great, I can help you do this. And so I set up another time where I can talk to them, but they can look at those Texas Medicaid events and see where our staff are and see where we can be, where we can help educate them. And so, you know, that's also another avenue for them. So as I said before, depending on where clients live or the population lives, there's different plans in each area. They try to base it on several factors, hospitals that are close, those kind of things, and then the health plans are there available for them with all kinds of different extra value added services, depending on what kind of medical coverage they have. And then a list of the health plans are available at that website that's there on your sheet. So you can go there and see where they are and in what area they are. I mean, we're going to see a map here in a minute that'll show you that too. So we kind of talked about this already, what Star Kids and Star Plus is, but it's the same benefits as the Star program. But it does include some of those extra services. So because of the needs of those clients, they are able to get long-term services and they are able to get long-term support, okay? They have a service coordinator who helps to coordinate the medical care and kind of helps get everybody talking. Because have you ever gone to multiple doctors before and they don't talk to each other? Mm-hmm. And you have to call and say, but I just need this test sent to this doctor. And so that's what the service coordinator does. And they identify the at-risk population that have multiple caregivers and they work with them. They monitor the service plan for the member and has regular contact with, and I love this part, not only the member and the providers, but family and other people who are trying to support them, okay? And so they try to work with all of those people. The service coordinator will work with providers of LTSS, which is just that long-term service supporters, and coordinate acute care services for people who reside in those IDD facilities and have those other programs that are listed there. Each one of our regions, as Texas Outreach and Informing, we also have a long-term services staff in our regions who only work with these populations. Everything they do is with these populations. So when you look at those Texas Medicaid events, you can even find those specific events too that only target, that also target Star Plus, Star Kids. So, and then you'll see here on the packet, in the packet, there's the map of the different coverage areas, and it has all the different areas and then the health plans that are in those areas. So if you have kids that move from one area to another, that's why sometimes it is needed for them to change a health plan. If that health plan is not available, like, you know, like I was telling some of you, I live in Dawson, but that's another area. It's not very far, but it's still another area. So if we had a kiddo move from here to on the other side of Blum, then that's going to be another area. And when they do the address change, the system automatically generates, hey, you got to change your health plan, okay? And so we'll start doing outreach to them to say, hey, it looks like you've moved into a new service area. Let's let you know what the service plans, the health plans are available in your area, and let's pick you another one. So anyway, but these are the different regions. As I said, I'm from Region 3, which is the Tarrant and Dallas service area. And then this is your region, which is pretty big, but Region 7 is the area that you all are in. And so it covers a lot of ground.
And that's the MRSA?
Yes, ma'am.
Okay,
Mm-hmm.
that's region.
Mm-hmm.
So do you think that the benefits of each of those different options vary? I mean, it's like if you're in one and then you've got to pick another one, are they all different as far as the
We're going to talk a little bit more about that, but that's a great question because the basic care is the same because it's those health plans are just conducting Medicaid services, right? And the only thing that varies from plan to plan are the extra value services. So, you know, one plan may give a pharmacy card. You know, if your kid gets their flu shot, you get a $10 pharmacy card. Or they may have other kind of gift cards. Or if a woman is pregnant and she does her follow-up visit with her doctor, they'll give her a care bag. You know, just different things like that, which are called the extra value services. But the basic care is still the same. And so they're still just handling basic Medicaid. And for those of us that remember Medicaid years ago, you know, it's still the same. It's just with a health plan in certain areas. Because the health plan, because of how they're already set up, can provide them a better service. Because they're already built with healthcare in mind, and they can provide extra service to doctors and different things. We have a department that goes out and talks to doctors and helps them come on to Medicaid. The health plans do the same thing, and so those are things that they can do. But yeah, good question. So did that answer your question?
Yes.
Okay, great. Mm-hmm. And so here in your area, and so you're that part of that MRSA and that central area, then your 3 medical plans in the STAR program are Right Care, Scott and White, Superior, and WellPoint. And again, those dental plans are the same as all the way across the state of Texas. MCNA, DentaQuest, and United Healthcare Dental are then your choices. Now for STAR Kids, on the other page, then the choices are Blue Cross Blue Shield, United Healthcare, and then of course those same dental plans. Those are the same all across the board, okay? And then if you'll keep turning, you'll see this is a sample of their Medicaid card. Every person on Medicaid will get this card. So family of 5 on Medicaid, they're gonna get 5 of these. And this number, their Medicaid number, stays with them. So like if we have a kid who's on Medicaid until they're 3, and then parents don't renew it for whatever reason, and then they go to apply for Medicaid again, they'll get the same number, okay? that number follows them. It's linked to their social security number, okay? And so that Medicaid card, we encourage them to take it to all their visits, because that pretty much tells anyone, any provider's office, any hospital, emergency facility, they know everything about them from that card. Also, it gives them information. If you'll notice on the back, it gives them a telephone number they can call, and it also gives them a way that they can replace it. And then also, the Your Texas Benefits website is there. They can actually print the card from there now. And then this is an example of the Superior card that the population that have Star Health, then this is an example of their card front and back. And that also gives them room, information to help them to navigate it gives them all the different telephone numbers for them to navigate. And so they'll have both of those cards. And then I don't think I have a dental one, because usually I have to add it. Oh. No, this one is another Star Health plan. So mom has 3 kiddos. That's just another plan example of a medical plan card. So mom has 3 kiddos. They're all 3 on Medicaid. She's going to have 3 cards for each kid. Okay? She's going to have a Medicaid card, a health plan card, and a dental plan card. And the reason why that is because Medicaid card stays the same no matter what. You can move from here to Amarillo, that card's going to stay the same. Okay? Medical plan card, dental plan also. So dental plan, move to Galveston, stays the same. But the medical plan is different depending on the area. So if someone asks you why to have, I had a lady ask me this yesterday, actually, this is why I'm talking about it, and she said, why do I have to have all these stinking cards? And I said, well, good question. And I said, this is why. And so that Medicaid plan just follows you. That card you can keep it till you're a grown-up. It's okay. But the dental plan follows you until you're 20, and the medical plan depends on where you live. It could change no matter what. So lots of good information on there though, and as I said, those important reminders that we tell everyone, that we encourage other programs to tell everyone. Keep the cards with you as much as possible, but man, keep your address updated as much as possible. And I know with these populations, it can be a little challenging for sure. And so, but we also do have those online access now. We have those telephone numbers that they can reach out. And then usually they'll have a review of some sort, or they'll ask for a review. And so yearly, we want to be sure to send that information back in for them. Okay. So just a few more things. So help using the benefits. So this is the Your Texas Benefits website that I talked about. Here they can report changes to their case. They can change their benefit status. They can check if they have an interview. That's in that website in their account. They can see items that are needed from the HHS office. Maybe HHS office says, hey, we need a new one of these, whatever. And they can see that there. They can also find out if you sent in documents, did they receive them? That'll also be there. It'll have a receipt beside that document. They can get a receipt for the items that they send in. They can order or print a new Medicaid card or a health coverage card. They can also get that there too. And they can, this is the biggest thing for me, this is the thing I love, is they can view their Medicaid coverage. They can view that there. What kind of Medicaid am I in? I just assisted actually a family that goes to church with me, and they said, hey, don't you work with this? And I said, sure. And so they called me on Monday, and I sat down and talked with them, and they have a young girl who's 17 who's just joined their family. Dad dropped her off and left, and so anyway, wonderful, sweet girl. And so they have no idea. We don't know. Does she have what? We don't know. And so we kind of helped work through that. And I said, this would be the first place I would start with, is I would go to the office, see, hey, is she in the system? Does she have benefits? If not, let's go ahead and get those applied for. And I said, but if you don't get an answer, just apply. Because if someone applies and they already have benefits, they're going to tell them that. Okay? They're going to say, hey, we've already got you.
Sorry, a child like that, 17, and she's not in foster care, so
No,
she's not an automatic,
no.
and she goes to live with someone else, does that automatically qualify her?
It depends on the situation, what she may already be in the system, and we don't work with that part of eligibility, so sometimes we don't know what those weeds are. But for the most part, this young lady actually ended up, she was not in the system. And so they were able to get her an application, and she was approved. And so they escalated it because she was abandoned pretty much. And so, yeah, a lot of times it just depends, on those situations. So, but yeah, exactly what you said, because that's what I said is, man, she's not with the foster system, so she doesn't get the auto. And so, hey, let's go in this avenue. And that's how it worked out. So, and then when another family member actually called her and to check on her, and which I was really glad to hear. And so, and she goes, no, you do have Medicaid, but she didn't. And so, anyway. And I said, yeah, you always got to check. And so, anyway. Okay, so here's also 211, which people can call. And 211, everyone always thinks of it as Medicaid line, and it is. There's always great information there, and you can contact someone to get with Medicaid. And this is the dialer for it. So when you call, you pick your language. Get help with Texas benefits is always option 2. So we tell someone, if you speak English, you call 211, press 1, then 2, and then 1 again. And then you're going to enter your information if you have it, and then you just do those processes, and that gets you to the right person. But also, if you call 211 and you press English and you press 1, that also gives you what services are available in your area. Like, is there help with rent? Is there help with electricity? Do you have a food pantry in your area? Do you need whatever? And so option 1 also gets them to the services that are available in their area. So anyway, so that's the dialer though, to get assistance through through 211. And then so on our next page though, we're going to talk a little bit more about the Texas Health Steps checkups that I was talking to you about. And the Texas Health Steps program is free to everyone who's on Medicaid under the age of 20, okay? So a lot of times they apply for Medicaid, and then they start getting this stuff from Texas Health Steps, and they're like, I don't know what this is. I didn't apply for this. And it's a free program that comes to them additionally if they have children who are young people who are on Medicaid. And so they get health information. So depending on the age of their children, it talks about things that they can do to keep their kids healthy, like wear a helmet when they ride a bike, buckle them in a car seat, and all those different things that they can do to keep their kids healthy. Then they provide that information. It also reminds them that dental checkups are every 6 months, and they start at the age of 6 months. And so that is always kind of foreign to people, because sometimes they'll say, but my kid doesn't have any teeth. And it doesn't matter. And so that dentist still wants to see them. And if there's an issue, they can get dental checkups as young as 3 months. And they can get those checkups every few weeks. Sometimes we have those children that come and they have dental issues, from lack of preventative care. And so they can get extra checkups even when they're very young. Now let's say they're younger than 6 months and they're toddling around and they have one little tooth and they fall down and something happens to them, they can get that emergency dental care, okay? But the checkups start at 6 months, and then they go every 6 months from then until they're off the program. So we tell them every 6 months. They have follow-up checkups and referrals to address health problems that are identified in the yearly checkup. I have a friend that she just took her little boy, and they actually found some problems with the back of his jaw, and so they just got referred to a specialist in Waco, and that was through a Medicaid dentist. And so they refer them out and get them lined up with someone else if they can't take care of it. but that's all the dental information. So we have the Texas Health Steps website that's listed there that has all kinds of different information. It has videos and all kinds of different information there for the about the checkups. And then, like I said, in those medical checkups are components. My little grandson, he's big now, he would say if he was here. He's 4. But when he was 6 months, I went with he and my daughter for his checkup because he has a rambunctious older sister. And so I was back there with her, and I just happened to be right across from the computer when the doctor was filling out this component sheet. So I got to watch, which was like, I geeked out super much about it. And my daughter was like, wow, Mom, this is a big deal for you. And I went, I know it is. And so, and it is literally a questionnaire that they go through, and they fill out all the information about that child, and they have a checklist that they have to do to be able to sign off. And so they have to do those certain things. So the health and developmental history is the nutritional screening, developmental screening, autism, mental health, and tuberculosis. Of course, they're going to do those measurements that we're used to. The oral assessment, they're going to do vision and hearing screening. They're going to do labs, immunizations, the dental referral, that begins at 6 months. They're going to talk to them about it at their medical checkup. Hey, have you started dental checkups yet? That kind of thing. That's part of those medical health components. And then, of course, they're going to refer them to other providers as needed.
I have a question.
Sure.
Back on the 211 flow chart.
Oh, sure. Sorry.
Well, it says you enter your social security number, and then it says to enter your case number. I don't want to make assumptions. Is that like a court case for foster children?
No,
Okay.
it's their case for their medical benefits. When they first get any documentation after they've applied, they have only a case number at first. You know, like if they've never been on Medicaid, they only get a case number. And then once they get approved for Medicaid, they get an actual Medicaid number itself. Mm-hmm.
Okay.
And so that if they apply 2 or 3 times before they actually get approved, then they would have a different case number depending on how many times they apply. Okay. It follows that application, if that makes sense. So, but even if they don't know either one of those things, it allows them to keep going through the automated dialer till they get to a person.
Oh, nice.
It's not like, sorry, you don't have that information.
Yeah,
See you next time.
It's more forgiving than some of the prompts.
Okay, and so with the dental services, it's exactly the same way. They also have a dental components with their checkups. They have those cleanings and examinations, sealants, oral health education. They provide all the parents with pamphlets, color sheets for the kids, all that kind of stuff. And then they also do follow-up services as necessary, braces if medically necessary. So unfortunately, they aren't automatic for everyone. That's probably our number one question with middle school kids. If that mama is standing there, well, what about these braces? And so unfortunately, they're only available if medically necessary. And then, of course, emergency services at any time. Little teeny baby falls, hurts their mouth, it doesn't matter. They can still take them to the dentist. Preventative services, checkups every 6 months, therapeutic services if needed, diagnostic services, the anticipatory guidance, and then they refer to those dental services as needed, so for sure. All right, and then another benefit that's automatic to Medicaid is the non-emergency medical transportation. So if they have a checkup at a doctor or doctor's appointment, doesn't matter if it's checkup or not, then if they are on Medicaid and they have no other means of transportation, then they can contact the non-emergency medical transportation. It helps them arrange for a ride by a transportation service coordinator company, and so it will set them up to be able to do that. Now this isn't available here in our area, but if they do have routes for buses, they do provide them with free tickets. And so, but they also have, what really falls into our areas is they do reimburse for mileage. So if you have someone who is constantly driving someone else because I had a lady a few months ago, she helped take care of her neighbor They weren't related or anything, but she helped take care of her neighbor. And so I told her, well, you can get signed up and they will reimburse you for the mileage that you're doing. And so there's a process, and they can contact that company, the emergency medical transportation, to do that. And all of this is done through the medical plan. Whoever the medical plan is, they will contact them for transportation. They will give them the name of the company and the number of the company, and they will give them the details. And most of the time, the details are they're going to need their plan number, their Medicaid number, where are you going? What is that appointment? What time is it? Where is it at? Do you need extra services with this? Are you going to be in a wheelchair? Do you have a cane? Are you going to have an assistant with you? Now, for children who are under a certain age, they have to be accompanied. And so mom can't just put a 3-year-old, in transportation and send them down the road.
And you said this is not
And y'all
available?
know why I'm saying that is
Yeah, 'cause
because
it
it's
happens.
happened.
Did you say it's not available for this region?
Buses.
Oh, no, it's not
Bus
buses.
passes.
Not the buses.
Not buses.
Like a
Yeah,
bus
'cause
pass.
Okay. 'cause
You
I
know,
was
this
gonna
is
say, we
like
don't have
DART.
very good
We don't have
transportation
that.
here.
And so,
No.
but the transportation is whatever transportation service company is in this area.
Okay.
And right now they have a big push where they've been trying to get more companies in all the areas of state of Texas. And so that's been a big push over the last year and a half. And so it's run by the health plans though. And so they're the ones that are trying to connect to get those. That's a recent transition. It was just with Medicaid, with the Health and Human Services offices, but now that's transitioned to the medical plans. And so they're trying to build up those companies as best they can, especially because of the rural areas, I guess. And so, anyway, I actually got to speak about that with someone from a health plan about 6 months ago. And so just to explain to them, hey, it's tough. And so, and also, if you'll see, there is also airline transportation. If a child has to go from Dallas to Houston to have a surgery, or from here to Washington or somewhere because of a specialized surgery that's been approved, then they will set up that travel transportation for them. So if the recipient is currently enrolled in managed care, then they will contact that medical plan, use that member ID, and get that done. Now, if they're not in a managed care yet, maybe they just got enrolled in Medicaid and they still are waiting on the medical plan to process, they can call that 1-877 MedTrip, and they will set up a pickup for them. Okay, and so that's that number there for them.
The biggest problem I see with that, and that's a great option
Yeah.
a lot of times, but it says call 2 to 5 days ahead, and you've got a sick child.
Well, now
you
that's
know.
considered emergency. And so if you have an emergency, you don't have to call 2 to 5 days. Or if you just got out of the hospital, or if you have to go to the drugstore even, then they will, if you have a prescription waiting, they'll do transportation for that too.
So you
Without
can call
Mhm.
like the day of or day before.
Yes,
Okay.
in
Do
certain
we have
situations.
something in Hill County for transportation?
The Blue Transit.
Mhm.
There is.
Mhm.
I have a flyer over there.
Mhm. So, but a lot of people don't know about the pharmacy thing.
I didn't
And
know
so
about
that's
that.
a real, people don't know about that one, and that you can. So like, if someone gets out of the hospital and they don't have any other transportation, they can set up a hey, I'm getting out of the hospital today, and they will arrange for them to be picked up. Yep. So, and that's exactly what that next portion is. And then they also want to just, as I said, let them know if they have any special needs. Do you have a wheelchair? Do you have those different kind of things that you just need assistance with? Because they want to send, especially with wheelchairs, they want to make sure they send out the correct vehicle to them to be able to meet their needs. So, okay, so on the next page, even more of that on page, the non-medical emergency medical transportation 3. Then these are the things that they will need to be able to set up the appointment. They'll need to give their client name, of course, their Medicaid number, Social Security number, or with some of the plans, they also have another special number that they can give. But they're going to tell them, where do I need to be picked up? and what is the home number or the number to be contacted at that address, and then the name, address, and phone number of where I'm going. Also the date and time and type of visit, what type of visit is there, and any special needs, of course. Also with the type of visit, the transportation company will look up, where is this? Where am I going? Do I have to, are they gonna need assistance to go up 5 floors, to this doctor's visit? Then they look that information up ahead of time so that the driver can be prepared. And so, anyway, so they do those kind of things for them too. All right, and then the next page is case management for children and pregnant women. This is a service that's automatic, and of course, case managers, whom y'all all probably know, are licensed social workers and registered nurses who help children, pregnant women, and their families get the necessary medical and dental services, educational services, locate resources, and other necessary services. Our staff keep, in whatever area of Texas we work in, we keep a list of the caseworkers in those areas so that we can refer them, because it is an automatic part of their benefits. In fact, the question is, do you think you need extra services? Not do you, but do you think? And so if they say, yeah, I think I do, and then we can give them. Moms that have newly diagnosed autistic children, a lot of those clients, or a lot of them that we refer. Maybe a mom who has a domestic issue, we refer them to the caseworker, try to get them assistance, that kind of thing. And so as you can see, it's that medical, dental, any educational issues, so maybe set them up with support for those kiddos, and then locating those resources for them. Okay, and so case management eligibility, they have to be able to get Medicaid, and they have to be a child from birth up to the age of 20 who has a health condition or health risk, or they are a high-risk pregnant woman, or anyone who needs assistance, who's on Medicaid, who needs assistance obtaining necessary medical, social, educational, or other services related to their health condition, health risk, or high-risk condition, and they just want case management. So a lot of times, if it's a mom who has some kids and she's like, I'm just in this situation, I'm just not sure, then we connect them with the case manager, and then the case manager goes and talks to them, assess the whole family. They don't just assess the one person, and they say, hey, how about this? And here, we can supplement you with this. And they just connect them with different services. So again, there's that telephone number to reach a case manager. They can also reach out to their health plan. So that main number for their health plan on the back of the card, they can just call it, or they can call 877-847-8377 to get help. And of course, we are all here just to be able to help you all in whatever way we can, and to be able to provide the support that we can. I've talked quite a bit about what we do, which is the rest of this presentation here. So I feel like I've really kind of given you all a good overview of all the things that we are available to do. Helpful hints, here is the next to last page. Keep their address and information up to date on 2-in-1. Now we understand that that's difficult for sometimes, but we just encourage them to keep it up to date. Keep your health care coverage by reapplying each year for Medicaid the month before the birthday using 211, and keep up to date by responding to any letters from Medicaid, and then just keep healthy with those medical checkups and dental checkups. And so the last page is my contact information, and also I've added Priscilla's contact information. She's the new regional manager in this area. She is actually in Austin, and so that's why it's a little bit of a trick for her. And I said, of course I can go, it's just down the road for me. And so we are both available to be able to assist with any questions, anything you all may come in contact with. I know that sometimes there's that one-off thing, which seems kind of funny, and so we're there to be able to kind of help navigate whenever you can. Any questions? Y'all been a good group. You guys good questions.
Sorry,
No, you're good.
Questions. It seems like it's been a long-standing challenge that one of the biggest problems is the providers, because
Correct.
we know someone who just a few weeks ago was trying to find, she was new to Medicaid and needed to find a doctor. And I was there with her, and she made 7 phone calls before
Correct.
she could find a doctor
Correct.
that would take her.
So did she have a health plan yet?
I
Or
don't
just
know.
okay.
I don't know.
So if they're new in Medicaid and they only have the Medicaid card, then you wanna call 211. Or you can call one of us, like you have my card, I can actually assist with this. But if they have the health plan, you wanna start there. And unfortunately, cause we have the same complaint.
Yeah.
We have the same issue. Is we have a doctor on our list today that takes Medicaid, and tomorrow when that client calls, they say, no, we're not doing that anymore.
She got responses like, we're at our limit.
Correct, and that's
You
another
know.
issue.
Yeah.
What if you get on a waiting list in case somebody
Correct.
drops off? the
We
waiting
have that
list?
too. Our most narrow population is obese. And so a lot of times we'll have the doctor will be full and won't be able to take them. And, so they'll have to wait, they'll have to see another doctor and then transfer over. And so, so that's really a constant issue for us. That's why we have a whole department that's what they do. They keep that information up to date. They help the providers navigate through the system too. And so, we understand that issue.
Do the doctors have access to look up their records if you can give them the social security number?
Yes, they actually do.
And
They use their name and their birth date and social security number if they can. And that allows them to look up what program they're approved for.
I figured that.
And that
my,
kind of
my
thing.
placement got harassed by the
Yeah,
offices.
but they can.
I
Mhm.
figured they can look up.
I
a
mean,
lot of
I've
stuff.
actually been on the telephone with a pregnant woman.
Mm-hmm.
Like she's standing at the doctor's office talking with me and the receptionist, and she goes, "Oh yeah, I see you now. You're approved." So
Well, it's very frustrating.
It
When,
is very.
But the other side of that is, my husband was an administrator for Baylor, Scott and White for a group of doctors, and he's on the other side saying, well, we
Correct.
can't get paid from, we get
Correct.
pennies on the
Correct.
dollar,
Yeah.
Correct.
Yeah,
So,
you get 27% of what you
Correct.
bill.
I mean,
Exactly.
that's
Insurance
horrible,
companies pay you
you know.
70%
Exactly.
of what
Exactly.
you bill.
That's the
So we
reason,
get it.
you
We
know.
definitely get it. And then sometimes, it's the timing.
Yeah.
Like the
That's-
doctor
that's
may
called
have
fraud.
already updated their information, but it didn't get, processed through us in time. So like our staff, what we do is we give multiple doctors. We give a minimum of 3 types of doctors. So if we have a mama who's pregnant and she has kiddos, then we give 3 OBs, 3 pediatricians, and 3 dentists because of that very same thing. And so, because we know sometimes it's just timing.
Yeah.
So, and with our area, I know even for me, I just had to find a new PCP. And I was like, man.
I have a
you know.
17-year-old and they're all telling me, now I can see her till this time, and I'm like, no, I don't want to find new doctors for her.
Yeah.
I know.
Some of
I
these
know.
doctors we've had since she was like 3.
I know. We had the same
Oh,
thing.
no.
happen.
So yeah,
Mhm.
yeah. And then she's like going to college. It's like, well, do I find her one here? Do I find her one there? What do I do?
Mhm.
And I mean,
For
we
sure.
have insurance, so we have more
Exactly.
options
Exactly.
than
Mhm.
Medicaid. Okay, so I have another question. I'm
Sure.
gonna be a big mouth with Brody then, so don't worry, we'll fight for the title.
Do you want to keep recording this question?
Yeah,
Okay.
yeah, this is
I'm just,
fine.
I'm just asking.
So I know we've had a teenager who ran away, but is still technically in foster care, but we were told her Medicaid was dropped. Did they, but you were saying if they're in foster care, they should have Medicaid till they're 25?
Well, if the authorized representative calls and says we don't want this, you know what I'm saying?
So
I think
CPS
it's
Or if
CPS
mom-
that's made the decision to drop her, but the
and
child
I don't
would
understand why that
qualify.
would be.
Yeah, that's what they told
I
us
think they
though,
said it
right?
goes inactive after like 60 days or something.
Well, no, what I got on that one was the caseworker told me that she had been dropped from Medicaid.
Yeah,
Well,
she
I
may
thought-
not
but I
know
thought
what
it was
she's talking
automatically
about,
60
though.
days after she ran away.
I don't know. I've just, I think
Yeah.
that's why I was asking the
And that
questions.
might
If
be.
she goes to
But
get
she can
help
still
at a
apply.
doctor,
She can still apply again
But-
as an unattended minor, right?
So if she, on her own, on Runaway, decided she needed some medical attention and could find a doctor to take her, they should be able to find her in the system.
If it is still approved, because there's many different ways that they could, like she said, there's also a time limit where it has to be renewed or it has to be updated or.
So
you know what I'm
if
saying?
they don't update it between 18 and 25, they're gonna lose it.
They're gonna, if they're still good, they're gonna be sent that package and they have to choose it, and they
Or
could
somebody
be
chooses.
defaulted for it, yes. But there is a possibility that a case head or an authorized representative, whoever that may be, can say, no, we don't want it. And can have them
See,
removed.
That's,
Mhm.
that's
I don't
something
like
we
that.
really
Mhm.
need to address.
Yeah.
with the
Because
department.
that's like, oh, that kid was difficult, so I'm gonna
And
cut
so
their
as an
Medicaid off.
18-year-old,
Amen to that, but she's still
they
needs
can-
medical
yeah.
care.
Right, yes, she's difficult, but she probably still needs to go to the doctor,
but
like,
they can still, they can try to apply on their own.
but it would be
Mhm.
based on,
Yeah, I mean, that doesn't work. You need to go to the doctor, well, you're gonna apply
I
for
know.
Medicare. You'll find out in
But
6
they may
weeks
still
whether or
have
not you can-
coverage, because
especially
I'm
if they don't have
telling
their
you,
documents.
there's so many times where they say, we don't have coverage, and they do.
That's why I'm thinking that's an
And so
internal
I
thing
would
for
definitely-
CPS
Can
that
we
may-
call
Check.
211 or whoever
And verify?
or could we call you and like with her information? Can
If she's
you-
with you,
But we have a court order, like a sign.
okay,
yeah.
but I mean, if she's with you, even the doctor should be able to still check in the system to see if they're covered. But I can check if to see if they're still covered.
I'd be curious if she still has
Mhm.
active coverage.
Yeah, me too.
Because you would be surprised that many times I'm like, nope, and I look it up, yep.
Yeah.
You know, like somebody come to me at a health fair, and they're like, well, you know, I'm gonna apply, but I want to know what I need, what else, and then I look, I'm like, you already have a case.
Yeah.
Well, I applied, and I thought they rejected me, and I'm like, no, you got approved, you know, so you never know. So I would definitely try.
Yeah.
And that is definitely, like my friend, that is one of those kind of weird areas, you know, and so. Mhm.
Well, that's good to know. Thank you.
Okay, going back to the 18 to 20, so if they are in foster care and they age out, you're saying that by default, if they don't choose, the system would choose another plan for them automatically if
Because
someone
they're gonna
cancels it?
switch over, like, if a kid is just a kid is on children's Medicaid, and they turn 20, that automatically switches over to the
They're
regular
on
STAR
children's
program.
Medicaid until 20.
Correct. It's like a children's,
Okay.
but for them that are in, it's superior.
Okay.
Because they're in foster care, okay, or whatever. And before they get to 21, they're gonna, I mean, when they get to 18, they're gonna give them the option to stay with Star Health or to go ahead and switch to Star or Star Kids, okay? And they're gonna give them the option. And if they don't want to, they'll stay with Star Health until they reach 21, and then they really gotta change. And so,
And then again at 21, do they have to choose? Do they have to do something or?
they have to choose a health plan or something. If
It
they're
won't be
still,
chosen
if the
for them.
eligibility continues, they will have to choose a plan.
Or
Now, we have seen though where they're dropped because of whatever reason or another,
But
and
if
then
they
they can
weren't dropped-
reapply.
would whoever just pick a plan and put them in a plan?
The state picks a plan
Okay.
if they don't choose a plan.
Even at 21 to 25?
Yes, but
Okay.
many times they have to send in some documentation to verify, you know, they're gonna get that documentation, so a lot of times people don't even know it. You know what I'm saying?
Yeah.
Because they're not at that address, or they're not getting the notifications, and so. So there is a possibility they can reapply also,
Okay,
okay? Because they still qualify within that age limit.
okay. So if they were on Medicaid at any point as a child, regardless of whether they were in foster care or not, they are eligible for Medicaid until 25?
Only foster care.
Well, but if
If
that
they're
kid
not-
that aged out gets a job making a whole bunch of money, they're not gonna qualify,
It
right?
sometimes, it depends. I'm not in that eligibility portion, so I'm not sure what that cutoff is. So,
But I'm thinking, so a kid that was just on Medicaid that was not in foster care would not qualify?
it depends on what kind of Medicaid they're on and what their circumstances are.
Okay.
But
There's
foster
not
kids
just
automatically.
correct.
Okay.
There's not just a stamp of, okay, you just keep getting healthcare benefits, because especially in the state of Texas, we don't have Medicaid for adults unless you're a pregnant woman or you have special needs or you're on foster care until you're 25. That's why at 25 it cuts off. So other states have that, but we don't yet.
So when pregnant women, they automatically qualify, I get that, but for how long? Like,
If a woman just finds out she's pregnant, she gets the proof of pregnancy, she applies for Medicaid, she's approved. Well, as soon as she sends in the application, we have 15 days to process. The HHSC does 15 days, start to finish. And so we try to do it quick. And so once she's approved, then she will be able to go ahead and choose her health plan and that kind of thing. The date of the pregnancy Medicaid is when she has her baby. When she has her baby, she has used to, until a few years ago, the prenatal care was just about 3 months after the baby was born. Now it's 1 year. So, and it's from the year that she has the baby. And so that's why we tell them all the time, please report the birth of your baby as soon as you can. The hospital usually helps them. And because their prenatal care is 1 year. And so it's same services for 1 year. And it's big, that's Governor Abbott did that a couple of years ago. So, and it's helped helped with the mortality rate with young mamas, especially.
And is it accurate that if a mom is on pregnancy Medicaid, when her baby is born, the baby would automatically be
Yep.
on?
If
Medicaid?
mama is already on pregnancy Medicaid, baby automatically gets newborn Medicaid, and they are in the same health plan as mama. If they want to
So is
change
that for a year? The
yes.
baby gets it for a year?
And then mama, after 3 months, can change the health plan for baby if she wants to. So, but that's for 1 year for newborn Medicaid. And then she can apply for children's Medicaid for baby after that. Usually about 10 months after the baby's born, they'll send her a packet to be able to choose.
My last question.
No problem.
What do you know about M-Tracks and your face tells me you're so excited about this. Okay, let's start there.
Not a lot.
Not a lot.
I'm
okay.
sorry.
I'm just
We don't
curious
deal
if
with it a lot.
y'all
So,
it's not like something automatic that providers are required to use. Because sometimes
I
we've
don't
got
know.
kids in the system that their
Correct.
shot records are just lost, and
Right.
it's like we've had kids that
They are
have to.
required to use it.
Mhm.
They are
They are.
okay.
But
Now, a lot of offices don't.
correct. That's what I was
They
about
are
to say
required
too.
to use it.
They are.
You're
And do
required
you
to
have
do
to
that,
opt in?
but we're
to
not
that?
going
Does the
to.
parent have to opt in?
Well,
I think you have to opt out. If I remember
If the doctor's office is doing what they're supposed to do.
I only know you do because I just went to the doctor. And I just had a checkup for the first time at this doctor, and they actually had the DSHS document was in there. And I was like, oh, my husband's like, I'm not signing that. I'm like, yeah, you are, sign that. And so I said, they want to track our immunizations. I said, we're going to let them. And so, so I do know that they do use it. But, if the person doesn't sign it or,
I know,
whatever.
I had to take Allie to the health department to get the second of one of the meningitis, whatever things, I don't know, because the doctor's office was out of them. And so we went to the health department and I had to sign a form, but it was if I wanted to opt out of using the
Correct.
M-Track.
At the health
like
department.
we've had kids
Yeah.
that basically like CPS couldn't find their shot records, so they had to go get all new shots to be enrolled in school or whatever it was because the parent didn't have the information. So I was just curious if that's something that every provider is required to use that would exist on every child unless their parent had opted out.
Yes, and to his credit, yes. All
Yeah.
those is correct.
they are supposed to now. It's a competency issue.
Correct.
People don't know that they're supposed to be using it or doing it. They call and say, well, I can't find you in the system.
Right.
You're just not looking right,
Right.
because you're required to do it.
But we also
Even
have
back when I was working
right.
at the doctor's
Right.
office, that's
And I'm sorry to say I hadn't got any
100 years
better.
ago. Yeah.
That's what I'm saying. I don't know a lot, but this I know. One thing I also do know is we have a large group of kids, and that's the reason why we do what we do, who don't get immunizations. You have a whole family of kids, they've never had measles shots, they've never had nothing. And so, that's why we have measles outbreaks the way we do now, is because of that. And so, anyway, so it is a little bit of both, but as far as what they do if that doctor doesn't do it, I don't know that end of it, so unfortunately, so. I know it's a struggle.
Yeah.
Mhm.
Anybody else have questions?
I had a question about service coordinators,
Sure.
actually. Do your service coordinators, do they keep detailed medical records, or are they just primarily coordinating, collaborating with, family and physicians and whatnot?
So that's a good question. So the service coordinator is with the health plan. And so that service coordinator may have, a certain amount of clients based upon that health plan. And what they do is they do keep records, and they keep records of who they're talking to and all of those things. And so as far as the details, I'm not sure about that because it is with the health plan. But I know 100% for sure, then they do keep records and keep up with everyone. And then our case workers, they also do the same thing. And so in the community, and connect them with the health plans, and so as much as possible, so, yeah.
Is
But
that
those aren't
information-
records that we can see.
Oh, right, that's exactly what I was about to ask
Yeah.
next.
It all stays with the health plan.
That's what I was gonna ask next.
Yeah.
So like, for example, if a guardian ad litem wanted, or perhaps requested access to that information for the purposes of advocating for the child, they could do that through the service coordinator.
It depends. And sometimes they can. It depends on what orders they have, and so. But can I? No. So, yeah.
Could they, for example, be a part of a group meeting where, say, we're introducing what's called CFE into our program here? We've already begun to. Could they be invited to a group meeting where parents and family members of fictive kin are present, and again, we're discussing the long-term permanency needs of the child, and we're discussing what the best placement options are, and they give their medical medical advice, or they give their expertise, whatever. Could they do that? Could they disclose that in that situation?
Possibly. It just depends on who has the right to speak about the benefits, you know what I'm saying? And sometimes, as you all know in this room, that's a big, thick part of weeds you're digging in sometimes.
Yeah.
You know, that Aunt so-and-so is the only authorized person on this case, and we haven't seen her in years, and so, you know what I mean? And so sometimes you can contact them, and if they are able to do it, a lot of them, they are, most of the ones I know, they love their job, and they do whatever they can do, and so.
I mean, the guardian, we would provide a court order.
Correct.
Which says.
Yep,
Make your.
just like you would with anyone.
Yes.
Yep, exactly. So whether they could or not, I'm not sure. It would just depend on the situation and the company, and sometimes where that coordinator is, some of them cover a large area. So, you're welcome. Y'all had really super good questions, man. Y'all put me to